Hello, my name is Bini Thomas, and I'm an assistant professor in the School of Physical Therapy and Rehab Sciences at the University of South Florida. My co-authors of the study are Dr. James M. Smith, Department of Physical Therapy, University of Connecticut, and Sandra Morgan, PhD student in the College of Nursing at the University of South Florida. We would like to present our systematic review on the impact of early mobilization within the intensive care unit following coronary artery bypass grafting. Coronary artery disease is the most common type of heart disease and the leading cause of death in the United States. Coronary artery bypass grafting is a well-established surgical procedure that restores blood flow to the ischemic myocardium by bypassing a narrowed or blocked coronary artery. Approximately 400,000 procedures are performed each year in the United States, making it one of the most common major cardiac surgeries. After CABG, persons have traditionally been placed on bed rest in the intensive care unit to reduce the demand on the body, conserve energy, and promote recovery. Recent evidence has been supporting early mobility. Research studies since the early 2000s have described early and rapid muscle wasting in patients in the ICU setting that occurs without progressive early mobility efforts. There has been increasing interest in the effect of early mobilization after cardiac surgeries, looking at early mobilization, timing, the effect on mortality, and functional outcomes of patients post-CABG. Based on the growing body of evidence about the benefits of early mobilization, it is important to understand the broader physical effects of early mobilization when applied following CABG surgeries. Therefore, the purpose of this systematic review is to evaluate the effects of early mobilization on the outcomes, length of stay in the ICU and hospital, on physical functioning among participants in the ICU following CABG surgery, and wanted to see if it would provide valuable insight into the impact early mobilization has on the trajectory of recovery following CABG. The study was registered with Prospero and followed PRISMA guidelines. PubMed, Embase, CINAHL, and Pedro databases were searched using mesh terms. Studies with early mobilization interventions for adults in the intensive care unit after CABG that recorded outcomes of length of stay or functioning were included in the study. Methodological quality was measured using the Pedro scale and Oxford levels of evidence. The inclusion criteria for the studies were adults who underwent CABG or CABG accompanied by valve surgery, patients who were hemodynamically stable during postoperative care in the ICU following and participated in early mobilization, defined for this review as engaged with intentionally progressed physical activities such as transitioning out of bed or ambulation performed in the first 7 post-op days. We also looked at studies that included only full text articles published within the past 15 years and written in English and included outcome measures of physical functioning that could impact the participant's length of stay in the hospital or quality of life. Physical functioning was identified by applying the ICF model to identify measures of body functions and structures such as the heart rate variability and or measurements of activity limitations such as 6-minute walk test. The exclusion criteria were studies with participants with 2 or more comorbidities, as those could influence performance on the outcome measures. Qualitative studies and review articles were excluded. Reports that did not have full text or conference abstract proceedings were also excluded. The systematic review collectively addressed 2,280 participants through 14 studies in 7 countries. The initiation timeframes for early mobilization varied, with the majority beginning within 24 to 48 hours after surgery, and interventions were heterogeneous. Early mobility was found to be effective in reducing atelectasis, improving oxygen saturation, and decreasing time spent on mechanical ventilation. Among early mobilization participants, the length of stay was reduced in all studies. ICU length of stay decreased by 1 day or greater in 6 of the 14 studies, and hospital length of stay decreased by 1 day or greater in 5 of the 7 studies. Data analysis found that early mobilization achieved better functional outcomes. It was found that implementing early mobilization led to decreased intensive care and hospital length of stays, reduced atelectasis and pleural effusion, and improved functional and respiratory outcomes in persons who underwent CABG surgery.